So as the debate over government-run health insurance rages on, in Georgia, efforts are already underway to keep the government out of health care. A group of Republican state senators argues that it would violate the 10th Amendment, which limits the federal government's powers. So they want to amend the state's constitution to protect Georgia from being forced to participate in any federal health reform. One of those lawmakers behind this effort is our next guest. He is State Senator Chip Rogers of Marietta, Georgia, or Mayretta, as they say down in your parts. Good to see you, sir. Thanks very much for being here. You want to rewrite your state's constitution so that Georgians don't have to participate in any government-run health care plan. Is it really worth that much that you would rewrite the Constitution for it?
Well, remember, to change the Constitution in Georgia, it has to be approved by the voters. So we simply want to give the voters this opportunity. But I think we need to take a step back. You know, we're talking about a national debate over health care, and what role the government has is what this debate is about. But one thing we all need to agree on is what is it that the government ought not do? What should the government not get involved in? And that's what this plan actually lays forth. What it simply says is that, you know, Georgians have the right to purchase health care from a doctor, and no government rule, no government law, no government mandate should ever trample that right. Consequently, if they do, Georgians want to opt out of that type of system. So that's the type of protection we're putting in place, and that is that if you want to buy health care, you should be allowed to buy health care. If you don't want to buy health care, you shouldn't be forced to have to purchase it.
But you're also arguing that the government, the federal government, does not and should not have a role in all of this. But Article 1 of the U.S. Constitution says that Congress has the power to lay and collect taxes, duties, imposts, and excises, and to provide for the general welfare of the United States. Couldn't the argument be made, Senator, that getting health care for all of those who don't have it, including the 1.6 million people in your state of Georgia, is helping to provide for the general welfare of Americans?
Well, nobody's against a plan that would provide health care for the 1.6 million who theoretically don't have it. I would submit to you that number is probably considerably lower. But the fact of the matter is there are people without health care coverage, and nobody's saying that that's not a good idea, that we shouldn't have a plan to help cover that. What we're simply saying is we reject any plan that tells an American citizen, particularly somebody here in Georgia, that you cannot purchase health care from a doctor. And that's specifically what this constitutional amendment deals with. It says that the right to purchase health care from a doctor, the right not to purchase health care from a doctor, is your right, and no government should take that away from you.
What do you mean when you say purchase health care from a doctor? I'm just a little confused. Are you talking about just going to the doctor's office, or are you talking about purchasing a health care plan from a private insurer? What is your beef? Because I haven't heard any plan that the Democrats have put out there that would prevent people from being able to go to the doctor. The president says if you like your doctor or your health insurance, you can keep it.
Well, if the president believes that, the Democrats believe that, then they should adopt our language and put it into their plan, but it's not in their plan. Remember, we're talking about a change to the Constitution. This deals with the issue that is being discussed today. This deals with the issue that may be discussed tomorrow. When you change the Constitution or ask the voters to change it, that's a very serious issue. And during this entire discussion over health care, one of the things that is very scary to people is a government that could tell them whether or not they can see a doctor. And we're simply saying, look, that's a right you have today, and a right that should always be protected. We want to give you the opportunity to protect that through the best means necessary, and that's through the Constitution.
Once again, I haven't heard anybody saying that people would not have a right to go see a doctor under some of the health reform plans that are being discussed, but you certainly have the right to pursue what you're pursuing down in Georgia, and it's a very interesting story. We'll continue to follow it. Thanks very much for joining us today, sir.
Thank you, Rick.